I'm about to tell you something that could protect your life, and it's hidden in plain view on every blood pressure reading you've ever had. Two numbers, one above the other. You've noticed them countless times. Your physician mentions them at every appointment, but here's what no one has explained to you clearly. One of these numbers is far more dangerous than the other, especially after age 60, and the number that's affecting more seniors might not be the one you're monitoring. I'm Dr. Sarah Miller, and after 20 years as a cardiac surgeon, I've operated on thousands of hearts affected by high blood pressure. I've held weakened hearts in my hands. I've seen the devastating effects of stroke after stroke. And I've watched families torn apart because someone ignored the wrong number, focused on the wrong target, and paid the ultimate price. What I'm about to share with you is based on decades of research involving millions of patients. This isn't a theory. This is proven life or death information that every single person over 60 needs to understand. By the end of this video, you'll know exactly which number poses the greatest risk to your heart, your brain, and your life. You'll understand why this number becomes more dangerous as you age. And most importantly, you'll know what to do about it starting today. This could be the most important 15 minutes you spend this year. So stay with me because the answer might surprise you. Let's start with the basics because I need you to truly understand what these two numbers represent. When your doctor or nurse wraps that cuff around your arm and it tightens, it's measuring the pressure of blood pushing against your artery walls. But blood pressure isn't constant. It's pulsing with every heartbeat. And that's why you get two numbers. The top number, the systolic pressure, measures the maximum force when your heart contracts and pushes blood out into your arteries. Think of it like a wave crashing. That's the moment of peak pressure. The bottom number, the diastolic pressure, measures the minimum pressure when your heart relaxes between beats. It's the calm between the waves. So if your reading is 150/90, it means the peak pressure is 150 millimeter of mercury and the resting pressure is 90. Now for decades, doctors focused closely on both numbers. If either one was elevated, you had high blood pressure and needed treatment. But over the past 30 years, as researchers have followed millions of people for decades, tracking who has heart attacks, who has strokes, who dies from cardiovascular disease, a clear pattern has emerged. And it's a pattern that becomes more pronounced the older you get. Let me tell you about two patients. Their stories will help you understand what I'm about to reveal. The first was Margaret, 73 years old. She came to see me for a routine cardiology evaluation. Her blood pressure that day was a 165/70. Now Margaret was thrilled. She told me, "Dr. Miller, my bottom number is perfect. I've been working so hard to keep it under 80, and look, it's only 70. I know my top number is a little high, but my doctor said, as long as the bottom number is good, I shouldn't worry too much." I wish I could tell you that Margaret's doctor was right, but 6 months later, Margaret had a massive stroke. The left side of her body was paralyzed. Her speech was slurred. The independent, vibrant woman who'd walked into my office was now dependent on her daughter for every basic need. The cause? Years of elevated systolic pressure that had been silently damaging the arteries in her brain, while everyone focused on celebrating her excellent diastolic number. The second patient was Robert, 68 years old. His reading was 128/95. Robert was worried sick. He told me, "Doctor, my bottom number has been creeping up for years. I read online that diastolic pressure is the real killer. The one that shows your heart is working too hard all the time. I'm terrified I'm going to have a heart attack." I ran a complete cardiac workup on Robert. Stress test, echocardiogram, coronary calcium score. His heart was fine. His arteries showed minimal plaque. Yes, we needed to address that diastolic number, but his risk was nowhere near what he feared. Two patients, two different patterns, completely different outcomes. And this brings us to the critical question that you came here to answer. Which number is more dangerous, systolic or diastolic? Before I give you the answer, I need you to understand something crucial. This question doesn't have the same answer for everyone. If you're 30 years old, the answer is different than if you're 70 years old. Your age fundamentally changes which number poses the greater threat. And since my audience is primarily people over 60, I'm going to focus on what the research shows for your age group specifically. Because this is where the answer becomes crystal clear and where understanding it can literally save your life. The research that changed everything came from multiple massive studies. The Framingham Heart Study followed over 5,000 people for decades. The MRFIT study tracked over 300,000 men. Study after study involving millions of participants all pointed to the same conclusion. After age 60, systolic blood pressure is a far stronger predictor of cardiovascular events than diastolic pressure. In fact, some studies showed that systolic pressure was 2 to 3 times more predictive of heart attack and stroke risk than diastolic pressure in older adults. But it gets even more interesting. Researchers noticed something peculiar. In many older adults, systolic pressure goes up while diastolic pressure stays normal or even goes down. This creates what we call isolated systolic hypertension. This is exactly what Margaret had. And for years, doctors weren't sure what to do about it. Some thought, well, if diastolic is normal, maybe this isn't really hypertension. Maybe this is just normal aging. We now know that thinking was catastrophically wrong. Isolated systolic hypertension is not benign. It's not just aging. It's a dangerous condition that dramatically increases your risk of heart attack, stroke, heart failure, and kidney disease. Studies have shown that treating isolated systolic hypertension reduces stroke risk by 30 to 40%. And heart attack risk by 15 to 25%. Those are massive numbers. We're talking about preventing thousands of deaths and disabilities every single year. So let me be absolutely clear. If you are over 60 years old, your systolic blood pressure, that top number, is the most dangerous number on your blood pressure reading. This is the number that's most likely to predict whether you'll have a heart attack or stroke. This is the number you need to be watching like a hawk. This is the number that needs to be controlled. Now, does that mean diastolic pressure doesn't matter? No, it absolutely matters, but it matters in a different way, and understanding this nuance is important because it affects how your doctor should treat your blood pressure. Let me explain the physiology behind this, because when you understand why systolic becomes more dangerous with age, everything makes more sense. Your arteries are not rigid pipes. They're elastic tubes that expand slightly with each heartbeat and then recoil. This elasticity, this ability to stretch and bounce back, serves a crucial function. It absorbs some of that peak pressure from each heartbeat, smoothing out the force and protecting your organs from constant pounding. When you're young, your arteries are flexible. They expand easily. This keeps your systolic pressure relatively low and your diastolic pressure relatively high. Because the arteries are still squeezing back during the resting phase, but as you age, your arteries stiffen. The elastic fibers in the artery walls break down and are replaced with stiffer collagen. Calcium can deposit in the walls. Atherosclerotic plaques develop. Your arteries become less like rubber bands and more like rigid tubes. Now, when your heart contracts and sends that wave of blood into stiff arteries, those arteries can't expand and absorb the pressure. The systolic pressure shoots up. But during the resting phase between beats, those stiff arteries don't recoil as effectively. The diastolic pressure often stays normal or even drops. This is why isolated systolic hypertension is so common in people over 60. It's a direct result of arterial stiffening. And here's the critical point, that elevated systolic pressure is not just a harmless marker of stiff arteries. It's actively causing damage. Every time your systolic pressure spikes, it's hammering your organs, your brain, your kidneys, your heart, your eyes. The delicate blood vessels in these organs are being injured with every heartbeat. Think of it like waves hitting a seawall. A few big waves don't cause much damage, but thousands of waves day after day, year after year, will crack that seawall. That's what elevated systolic pressure does to your blood vessels. It creates tiny injuries. Your body tries to repair them, but the repair process leads to more stiffness, more inflammation, more atherosclerosis. It's a vicious cycle. The brain is particularly vulnerable. The small blood vessels that feed your brain tissue can't handle chronic high pressure. They develop microaneurysms, tiny weak spots that can rupture, causing hemorrhagic stroke, or they become narrowed and blocked, causing ischemic stroke. And even if you never have a major stroke, chronic high systolic pressure causes thousands of tiny silent strokes. Microscopic areas of brain tissue die. Over time, this leads to vascular dementia, memory loss, confusion, personality changes. Many cases of what we call Alzheimer's disease are actually vascular dementia from years of uncontrolled systolic hypertension. Your heart suffers too. That poor muscle has to generate enormous force to push blood into stiff, high-pressure arteries. Over time, the heart muscle thickens trying to keep up with the demand. This thickening, called left ventricular hypertrophy, is dangerous. A thickened heart is a stiffer heart. It doesn't fill properly. It doesn't pump efficiently. This is how you develop heart failure, not from a single heart attack, but from years of your heart working overtime against elevated systolic pressure. Your kidneys contain millions of tiny filtering units, each supplied by delicate blood vessels. Elevated systolic pressure damages these vessels, causing kidney disease. Once your kidneys start failing, they can't regulate blood pressure properly anymore, which makes hypertension worse, which damages the kidneys more. Another vicious cycle that can end in dialysis. Now here's where people get confused, and I need to address this directly. Does a low diastolic pressure mean you're safe? Absolutely not. In fact, there's a concerning phenomenon that occurs in some older adults with very stiff arteries. Their systolic pressure is very high, but their diastolic pressure is very low, sometimes below 60 or even below 50. This creates a very wide pulse pressure, the gap between systolic and diastolic. A wide pulse pressure is actually its own risk factor. It indicates severe arterial stiffness. But here's the tricky part. That low diastolic pressure means that during the resting phase of the heartbeat, the pressure in your arteries drops significantly. Your coronary arteries, the vessels that supply blood to your heart muscle, fill primarily during that resting phase. If the diastolic pressure is too low, your heart muscle might not get adequate blood flow. This can lead to angina, chest pain, and even heart attacks, despite having open coronary arteries. So the ideal situation in an older adult is not a sky-high systolic with a low diastolic. The ideal is to have both numbers well controlled. But if we had to prioritize, if we had to say which number is most critical to get under control, the evidence is clear. It's systolic. The top number, the one that spikes with every heartbeat and pounds your organs relentlessly. Let me share what the current guidelines say, because this is what you need to know for your next doctor visit. The American College of Cardiology and the American Heart Association updated their guidelines in 2017. They lowered the definition of hypertension to 130/80. That means if your systolic is 130 or higher, or your diastolic is 80 or higher, you have hypertension. But they also emphasize that for older adults, systolic control is the primary goal. For most people over 65, the target is to get systolic pressure below 130. Some guidelines suggest that for very healthy older adults, even lower targets like below 120 might be beneficial. Based on the SPRINT trial, which showed dramatic reductions in heart attack, stroke, and death with intensive systolic control. However, for frail elderly individuals, especially those over 80 with multiple medical conditions, slightly higher targets may be more appropriate to avoid complications from overly aggressive treatment. The key point is this: if your systolic pressure is above 130, you need to take action. You need to work with your doctor to bring it down. And if your doctor is dismissing an elevated systolic pressure because your diastolic is normal, you need to have a serious conversation. Show them the research. Ask specifically about treating your isolated systolic hypertension. Your life may depend on it. Now, what about treatment? How do you get that systolic number down? The answer involves both lifestyle changes and often medication. Let me walk you through both because you need a complete strategy. Lifestyle changes are foundational. First, sodium restriction. This is massive for blood pressure control, especially systolic pressure. Most Americans consume over 3,400 milliliters of sodium daily. The recommendation for people with hypertension is 1,500 to 2,000 milliliters maximum. Reducing sodium can lower systolic pressure by 5 to 10 points. That's substantial. Cut out processed foods. Don't add salt to the table. Read labels obsessively. This alone can make medication more effective, or in some cases, reduce the need for it. Second, weight loss if you're overweight. For every kilogram, about 2.2 lb you lose, you can expect systolic pressure to drop by about 1 point. Lose 10 lb and drop 10 points. Combined with sodium restriction, you're looking at potentially 15 to 20 points of systolic reduction from lifestyle alone. Third, regular aerobic exercise. Walking, swimming, cycling, anything that gets your heart rate up moderately for 30 minutes most days of the week. Exercise has multiple beneficial effects on blood pressure, including improving arterial elasticity over time. It's not just about weight loss. The exercise itself is medicine. Fourth, limit alcohol. If you drink, keep it moderate. More than 2 drinks per day in men or 1 in women can significantly raise blood pressure, particularly systolic pressure. Fifth, stress management. Chronic stress elevates cortisol and adrenaline, both of which raise blood pressure. Meditation, yoga, deep breathing exercises, whatever works for you to calm your nervous system, do it daily. But here's the reality. For most people over 60 with systolic pressures above 140 or 150, lifestyle changes alone won't be enough. Medication is almost always necessary. And this is where I need to be very clear. Blood pressure medication is not a failure. It's not a sign that you didn't try hard enough. For older adults with stiff arteries and elevated systolic pressure, medication is often life-saving. There are multiple classes of blood pressure medications: diuretics, ACE inhibitors, ARBs, calcium channel blockers, beta blockers. Each works differently. Many people need 2 or 3 medications to control systolic pressure adequately. This is normal. This is not excessive. Your doctor will choose medications based on your other medical conditions. If you have diabetes, certain medications protect your kidneys. If you have heart failure, others help your heart function better. The important thing is finding the right combination that controls your systolic pressure without causing intolerable side effects. If one medication makes you dizzy or causes a cough or creates any problem, tell your doctor. Don't just stop taking it. Ask about alternatives. There are so many options available that almost everyone can find a regimen that works. And here's something critical. Once you start medication, you can't just check your blood pressure at the doctor's office every 6 months and assume you're fine. You need to monitor at home. Get a good quality home blood pressure monitor. Check your pressure in the morning and evening for the first week of any new medication or dose change. Once you're stable, check it at least weekly. Keep a log, bring it to your appointments. This data is incredibly valuable for your doctor to optimize your treatment. Some people have what's called white coat hypertension. Their blood pressure is fine at home but spikes in the doctor's office due to anxiety. Others have masked hypertension. Their pressure is fine in the office but elevated at home, which is actually the more dangerous situation. Home monitoring catches both of these patterns. It gives you and your doctor the real picture of what your blood pressure is doing day to day. Now let me address something I hear constantly. People say, "But Dr. Miller, my father lived to 90 with high blood pressure and never took medication. Why should I?" Survivorship bias. That's the answer. For every person who lives a long life, despite untreated hypertension, there are many more who died from stroke or heart attack in their 60s or 70s. You don't hear their stories because they're not here to tell them. The data is overwhelming. Treating elevated systolic pressure saves lives. It prevents strokes, it prevents heart attacks, it prevents heart failure and kidney failure. The number of people who need to be treated to prevent one cardiovascular event is small. We're talking about treating 15 to 20 people to prevent one stroke or heart attack over 5 years. Those are excellent odds for a medication that's generally well tolerated. Another thing people say, "I feel fine. My blood pressure is high, but I have no symptoms. Why treat something that's not bothering me?" Because by the time high blood pressure causes symptoms, massive damage has already occurred. The stroke happens suddenly. The heart attack strikes without warning. You don't get a gentle warning from your body that your systolic pressure has been too high for too long. The first symptom is often the catastrophic event. This is why hypertension is called the silent killer. It doesn't announce itself. It works quietly year after year, damaging your arteries, weakening your heart, setting the stage for disaster. Waiting for symptoms is waiting too long. Let me also address a dangerous myth. Some people believe that blood pressure naturally rises with age and that we shouldn't fight it. They think treating blood pressure in older adults causes more harm than good because dropping the pressure too low will reduce blood flow to the brain and cause falls and confusion. This is largely false. Yes, we need to be thoughtful about not dropping pressure too rapidly or too low in very frail elderly individuals, but the vast majority of people over 60 benefit enormously from blood pressure control. The HIVET trial specifically studied people over 80 with hypertension. They found that treatment reduced stroke by 30% and death from any cause by 21%. Treating blood pressure in older adults doesn't harm them, it protects them. The key is doing it appropriately with careful monitoring and adjustment. So let me bring this all together with clear action steps. If you're over 60, here's exactly what you need to do. First, know your numbers. When was the last time you checked your blood pressure? If it's been more than a month, get it checked this week. If you don't have a home monitor, buy one. They're inexpensive and widely available. Get one that's been validated for accuracy. Second, pay attention to your systolic number specifically. If it's above 130, especially if it's above 140, you need to talk to your doctor about treatment. Don't let anyone dismiss it because your diastolic is fine. Isolated systolic hypertension in someone over 60 is dangerous and requires treatment. Third, implement lifestyle changes regardless of your numbers. Even if your blood pressure is normal now, these changes will help keep it that way. Reduce sodium, maintain a healthy weight, exercise regularly, limit alcohol, manage stress. These aren't optional add-ons, they're foundational. Fourth, if your doctor prescribes blood pressure medication, take it consistently. Set alarms, use a pill organizer, make it part of your routine. Missing doses causes your pressure to swing up and down, which is actually worse than consistent mild elevation. Consistency is everything. Fifth, monitor your blood pressure at home and keep records. This empowers you and gives your doctor real data to work with. It transforms you from a passive patient into an active partner in your care. Sixth, never stop or change your medication without talking to your doctor first. I can't stress this enough. Suddenly stopping blood pressure medication can cause a dangerous rebound spike. If you're having side effects or concerns, call your doctor. Adjust the plan together. Don't go rogue. And seventh, get regular checkups. Blood pressure control isn't set it and forget it. Your needs change over time. Your kidney function changes. Other medications get added. Your blood pressure medications may need adjustment. Stay engaged with your healthcare team. I want to end by bringing you back to Margaret, the patient who had the devastating stroke because her elevated systolic pressure went untreated. I think about her often, not because she was unusual, but because she represents thousands of people who are walking around right now with the same pattern, elevated systolic pressure, normal or low diastolic, thinking they're fine because one number looks good. If Margaret had understood what I've explained to you today, if she'd known that her systolic pressure of 165 was the real danger, if she'd insisted on treatment, I genuinely believe she'd still be independent, still gardening, still living life on her terms. But that knowledge never reached her. She trusted a system that didn't clearly communicate which number mattered most. You now have that knowledge. You understand that after age 60, your systolic blood pressure is the critical number, the dangerous number, the one most likely to predict your cardiovascular future. You understand why it rises with age due to arterial stiffening. You understand that treating it can prevent stroke, heart attack, heart failure, kidney disease, and even dementia. And you understand that treatment works and is generally safe when done appropriately. This information is power, but only if you act on it. Check your blood pressure, talk to your doctor, make lifestyle changes, take your medications if prescribed, monitor your progress, stay engaged. Your heart, your brain, your kidneys, your life. All of it depends on keeping that systolic number under control. Before I go, I want to ask you to do two things. First, subscribe to this channel. I'm committed to bringing you clear, evidence-based health information that cuts through the confusion and gives you what you actually need to know. Second, share this video. Think about your friends, your spouse, your siblings. How many people over 60 do you know who check their blood pressure and focus only on that bottom number? How many people have elevated systolic pressure and don't realize the danger? Sharing this video could literally save someone's life. And leave a comment. Tell me your blood pressure story. Were you surprised to learn that systolic is more dangerous after 60? Have you been struggling to control your numbers? What questions do you still have? I read every comment, and your input helps me create content that serves you better. Your heart has been beating faithfully for over 60 years. Every single beat, billions of times. It deserves your attention and your care. Controlling your systolic blood pressure is one of the most important things you can do to protect it. Don't let that top number fool you into thinking everything's fine when it's elevated. It's the one to watch. It's the dangerous one. And now you know.